Okay, good morning, Dr. Fine. How are you?
I am fine, as my name implies. Thank you very much, Katie. It's a pleasure being here with you this morning and with your class. As you know, and I'm just about to explain to your class, I have been teaching at FCC for a number of years. Um, my background is in microbiology with a specialty in viruses. And so I've enjoyed my teaching career at FCC, and it's great to be able to continue in this venue to be able to help you and the other instructors in the biology department with the teaching of our students. So it's a pleasure for me to be here today, and I want to thank you for that.
Absolutely, absolutely. Okay, are you ready to get started with our questions?
Yes, I am.
Okay, so can you please tell us, define for us, what is a global pandemic and why is that significant?
Well, the words itself tells us what it is. First of all, global meaning it surrounds the entire Earth. In other words, there's no parts of this planet that couldn't be affected by it. A pandemic is a term for a type of infectious disease that could affect all people of all parts of the Earth, as compared to an epidemic, which means it's localized, or an endemic, which is a disease that just resides in a sort of a silent form in certain areas. So pandemic is the worst.
Okay, okay. So is COVID-19 the same virus as a seasonal flu?
Well, both COVID-19 and the seasonal flu are contagious respiratory viruses. That means viruses which attack your lungs and your whole respiratory system. But they are caused by two different viruses. That is, COVID-19 is a coronavirus, and the flu is caused by one of the influenza viruses. So it's a different classification, but they're both viruses.
Okay. Should it be shutting down our society as much as it is?
Well, this is a hard question to answer. I've had other people ask me that same question. Now, certainly there's portions of our society that need to be shut down to avoid the spread of the virus, particularly large gatherings or in places where people are in very close quarters with one another, such as nursing homes, where it's difficult to control infection to other susceptible individuals. But with proper precautions such as face masks and hand washing and cooperation of people, much of society should be able to function. The ability to keep grocery stores open, for example, and certain restaurants and businesses during the epidemic has been an example of how, with a little bit of prudence and good practice of safety, we can keep that part of society open.
Okay. So how has this virus evolved since we started observing it last September?
Well, of course, when it was first reported a year ago in September, we knew very little about it. And then we started hearing more about it at the beginning of this year. And at that time, it was probably thought that it was a one and only type of virus. But it appears that there's, excuse me, more than one strain of this virus. And so that would indicate that it has evolved some over the past years. And when they've done nucleic acid sequence analysis of the virus that was isolated from people in Europe, and that it would appear that the same virus exists, or it entered the eastern coast of the United States. And that's different from the virus that was reported in the earlier cases that might have come into our country through from Asia, from the western United States.
Okay. So scientifically, what has been discovered about the virus and how it's spreading?
Well, based upon there's a massive amount of serological data, which actually serological means that you have scientific data that um, is based on the testing for this virus, for example. It's been collected over, all the states and cities and the various and vast amount of people that have been infected by the virus. And it's now apparent that the virus spreads very easily, very rapidly from one individual to another, either directly by contact, such as the aerosol that's created when somebody coughs or sneezes, or indirectly if the person comes into contact with a contaminated surface. And that's why good hygiene, such as washing your hands, is important, because if you touch a doorknob that somebody else has touched, or drink from a glass that somebody else has drunk from, who might have the virus, you are possibly exposing yourself to it.
So medically, what has been discovered about the impacts of this disease on the human body?
Well, that also is a rather diverse but informative type of question. Now, for some relatively healthy persons that become infected with COVID-19, they may not experience any symptoms at all. So in other words, it has no effect on the body. And we refer to that as asymptomatic infections. While other relatively healthy people will have fevers, they'll have cough, shortness of breath, fatigue, chills, body aches, headaches, sore throat, congestion, runny nose. So it's really a gamut of types of effects or symptoms that a person is going to experience. We don't know if there's going to be any long-lasting effects on that type of a healthy person, but certainly individuals that are high risk, and that would be the elderly or the people who are obese, have diabetes, heart disease, kidney disease, whatever, they are going to experience a much more severe illness and even death. So it really depends when you say what are the impacts on the human body. It depends on how healthy the individual is or what type of resistance they might already naturally have to the virus.
So then does that inform what their recovery is going to look like as well? So when someone says they've recovered from the disease, what does that mean?
Yes. And when you use the word, or when we use the word recovered, of course, we always think about when somebody gets better, so to speak, gets over an illness. So to talk about what the recovery is from COVID-19 is sort of an ambiguous type of thing. Now, I understand that those people who are healthy and have come through the disease seem to have a full recovery, just as if they had been infected with the flu. And of course, once we have the flu, we get over it and then we have resistance. I fear, however, that in time we might find an infection by COVID-19 is different. It may have caused other damage to the body. And that fear that I have, or skepticism about it, is based on the fact that we know now that COVID-19 does affect other parts of the body. It affects the heart, for example. And so that might predispose somebody to later on in life to having heart disease or having some sort of an issue with their circulation. And the same may be in terms of if some of this virus manages to get into the brain. It may not be apparent right away, but maybe later on in life, it's going to predispose that person to a stroke or something else like that.
Okay. So through the science of researching this over the past year, have they found that genetics have anything to do with people's resilience, to be asymptomatic, or is it all within how healthy you are?
That's an excellent question, Katie. Now, one might very well wonder that if there are a number of individuals who become infected but really don't show the disease, maybe there is a genetic basis to their resistance or their, you know, lack of being symptomatic. So there have been a number of studies, and I looked into one which was recently published in April of 2020 in Scientific American. And it reported that there was a silencing of a gene called TICAM2. Now, I don't expect your class to remember that, but the point is that there is evidence of this gene being shut off from functioning as a result of the COVID virus. Now, that particular gene is very important because that gene activates a group of receptors. Now, receptors, if your class is not aware of it, are protein molecules that are on the surface of a nerve cell or any cell in the body that receives signals. And so what this paper would implicate is that COVID-19 shuts off these toll-like receptors on cells and might then therefore have altered that cell so it's now more susceptible to being infected by COVID-19 than a normal cell, which has this receptor in an active state.
So when does somebody know whether they should be tested for the virus?
Well, we keep hearing that kind of thing in the news in terms of, you know, should everybody get tested? And so the recommendations, which I feel are very sound by our health officials, is the person should only be tested if they suspect or have knowledge of coming into contact with somebody who's had COVID-19 or has become ill and suspects that it might be COVID-19. So it doesn't really do any good to test people who are feeling perfectly healthy and have sort of abided by the social distancing, et cetera, because they would test most likely negative anyhow.
Okay.
So the number of persons that are being tested also is highly dependent upon where those people live, even what state they live in, because some of the states have a real low incidence and others have a high incidence. Also, it should be guided by what is the rate of infection in that particular city. So if you lived in New York City, you might be very prone to want to be tested or be on the outlook for, you know, having contracted the virus. And maybe what occupation you're in. I mean, somebody that works in a restaurant is obviously in more risk of exposure than a farmer, let's say, that doesn't come into contact with other people.
Mm-hmm. So I've read that that animals are able to contract the coronavirus. So how does that work? Where animals to human, human to human, human back to animals? What does that look like?
That's an excellent question, and I'm sure a lot of people are concerned about that because they say, well, can my cat get the virus from me, or can I get it, you know, if the cat gets infected, can I get it? You know, there were reports that some wild cat, when I say wild animals, what I mean is like tigers and things like that, and some of the zoos had contracted COVID. And we really don't know how that might have happened, but here's the explanation. These so-called receptors that I talked about a minute ago, which are the proteins that's on a cell that allows a virus to attach and then infect that cell, those are shared among animal species. So in other words, you could look back at different animal species, and I'm not referring to humans, but saying like monkeys or cats, dogs, whatever. They have similar receptors on their lung cells as we do. So we share those receptors. They have been shared through the evolution of species. And so if the virus is able to attach to the cells in a bat or in a chicken or something like that, from which this virus most likely did originally come from, there's no doubt that it could, if it was living, so to speak, in those types of animals, it can live in us, it can be transmitted from species to species. And that is very well known for other viruses, such as the influenza viruses that all have emanated from particularly the heavily populated food markets that are found in countries like China.
So where is the United States right now with our numbers for those testing positive and deaths caused by COVID-19? And how accurate do we think those numbers are?
Well, having a preview of your question it allowed me to sort of give your class the latest information. As of this week, the U.S. currently is 8th in the world in terms of numbers of deaths per 100,000 individuals that are infected with the virus. However, when we hear numbers like that, we shouldn't think that that's really bad, because if we look at the percent positive of individuals for the virus and the percent fatal infections of the virus in the United States, our rate of fatality is very low. It's less than or around 3%, which means 3 people out of 100 are, really at risk of dying from it. So even though we rank 8th in the world, that really doesn't paint a bad picture for us, because we're doing quite well as far as survival and treatment. And there's also other factors that would influence the reports that we hear on a global basis. And some of that might be the reliability of the test that's being used in various countries. Also, it might be the reliability of the reporting. It's clear that there are some countries that are suspect of really not giving the data out as much as the United States. And of course, we are testing many more people than many of the other countries, particularly the third world countries, because we have that technology.
So then I guess that leads right into my next question of what areas of the world are continuing to see an increase in positive cases, and where are we seeing a decrease or what they're calling an eradication of a virus?
Well, it's difficult to compare the United States with other countries without considering that the United States is actually 50 small countries, if you think about it that way. And so most of our states are experiencing a significant decline in the number of infections and the number of deaths. The exceptions to that are some of the states that have a dense population or have been participating in a lot of activities in which people are coming in close contact with each other. The examples are California, Texas, Georgia, and Florida. And certainly with this latest hurricane that experienced in Louisiana, that's going to be a major factor there also, because it's very difficult to keep people away from one another there. Nonetheless, all of the states have experienced a decline in the number of infections, as well as the number of deaths in the past several weeks to several months. Now, I've talked just about the United States here, but other countries have seen similar trends. But at the same time, there have been outbreaks of COVID-19 around the world, and in countries with alarming increase over the past week. So whereas we're doing quite well in terms of recovery, other countries are not doing very well. Reports from the 23rd of July showed that South Africa, for example, is one of the top 5 hardest hit countries in the world. And at the same time, half of the cases in the world have come from from the United States, and from South America, particularly Brazil and also in India.
Okay, so is it possible to completely get rid of this virus?
No. Okay. So, in the other way to that you might have asked this is, can we eradicate the virus from the human population? And the answer really is basically no. While we can reduce the number of cases by isolating people and by using masking and social distancing and things like that, the virus will still spread, creating a herd immunity. Now, that is a good thing in some senses, because if a lot of the individuals have gotten the virus and are protected, then it's less likely that the disease will continue to spread. But the virus is changing by mutating, and so it's not going to be possible to completely eliminate it from the planet, because it's changing, and with the vast number of individuals on our planet, it's not possible to get everybody immunized, either naturally or artificially immunized.
Okay. So then you mentioned some of the hot spots that are in the US right now, Texas and Florida, California. Is there a way to contain the virus in those places?
Yes, there are ways, but it really requires a lot of cooperation from the general public, as well as from the health officials and the government officials. And the best way to contain that virus in a major city is to use those practices that we hear daily about, and that's good hygiene, using masks and social distancing, and also the contract tracing that is being done by our health officials, which we don't hear very much about, but it's going on behind the scenes, that there are literally thousands of people being tested every day, and when somebody is known to be positive, they immediately try to find out who that person has been in contact with, and then they will go and test those. And that's the only tool we have right now until we get some medical innovation or a vaccine of some sort.
Okay. So we're going to get to questions about that vaccine in one moment, but I want to know, how is Maryland comparing to other states, and what factors are contributing to those numbers?
Okay. Well, currently Maryland ranks 19th out of the 50 states in terms of the number of cases. So, so that's a good news, bad news type of thing, which means that our state is doing quite well, but on the other hand, we can continue to try to do better. And the factors that have contributed to the numbers in Maryland um, are probably some of the following. First of all, consider that Baltimore is really the only major city in Maryland, and that's where the most dense population of Maryland is. In comparison to some other states, like let's say California, where you have San Diego and you have San Francisco and Los Angeles, etc. So we are sort of fortunate that most of our population, though it's heavily concentrated in the Baltimore area, we have the rest of the state where it's not so densely populated. So we also, our government was very quick to, our governor and the government of the state of Maryland was very quick to respond to shutting down our state during the time when other states like New York were experiencing high infections and where they were not taking such a proactive stance. I think that Governor Hogan responded very quickly. We might not have liked what he did, but I think it was very effective.
So then, has the state-guided process, where all the states have their own processes, has that been effective? How would it have looked different if it had been a federally guided process where every state was doing the same thing?
Okay, so Katie, let me answer the first question. You asked whether it's been a effective process of guiding the states. Well, we need to realize that because the differences that we find in the way people are living and situated in the various 50 states, it had to be left to the states to do the administration of that, because a federal mandate would not have been, it might have been very effective in, let's say, New York, but it might not have been, that same mandate might not have been effective in Kansas or Iowa or someplace where you have much different situations. And so the states have done a fairly good job. And that was that, all the states were mandating that people would do the social distancing, et cetera, et cetera. But some of the states were allowed to reopen, perhaps prematurely. And I think what compromised that was that people thought that, well, it's over and we're no longer at risk, and they began to not follow the measures of safe distancing and wearing masks and avoiding coming to close contact and hand washing, et cetera. So it's not the states that they're blaming. Frankly, it's the human population. So that's a long answer to your first question. That the guiding process has been partially effective by the states. How would it look different if it were a federally guided process? No one can be sure, but I would say that the whole reentry safety program has even if it were federally mandated, it would have been, okay, everybody has to follow these rules. And for a diverse country like the United States, a one-size-fits-all approach does not work, because surely the people who are not at high risk aren't going to want to be under the same mandate as somebody that lives in Baltimore or New York City or San Diego or something like that.
Okay. So as a virologist, what has been your reaction to watching COVID-19 spread from a biological perspective and a social perspective?
Okay, that's a very good question. As a virologist, my reaction has been that with regard to this whole pandemic experience, is that it was predictable. Viruses have been spreading, particularly pathogenic viruses have been spreading throughout populations for as long as recorded history, and obviously before that. As for my social perspective, though I'm not trained in understanding human behavior, I am surprised at how our so-called civilized human population has responded. Persons who are not intimately trained in the dynamics or the mechanics of infectious disease typically lack the understanding of the principles of infection and how microbes, including viruses, spread, and how people should be or can be treated for those diseases. And I'm not saying that individuals, the general public, is naive. It's just that they have not benefited from taking courses in medical issues and biology, et cetera, as I have. So that's why I feel I do have a better understanding, and I'm fortunate in that I can sort of use my sound judgment in evaluating risk versus benefit.
So who are the populations that have been most affected by the disease?
It's predominantly individuals who are over 60, such as myself, and I won't indicate my age, but I am over 60. And for those people who are immunocompromised and have their health been immunocompromised, such as somebody who is obese, somebody with diabetes, somebody who has respiratory problems like black lung or maybe cancer or drug abuse, HIV. Those are situations where a person's immunity natural immunity has been compromised, and so they're very susceptible if they get the virus to really having suffering a major illness, including death.
Okay, so schools across Maryland are virtual, from elementary schools through our colleges. Was this the appropriate choice? Other states and colleges have chosen for students to return with precautions. Is that a good idea?
Well, the first question is, do you think there was an appropriate choice to have virtual classes, such as FCC? Okay.
Yep.
So I need to respond to that by saying, well, states differ and schools differ and communities differ across the state. So what works in Maryland might be different than what works in Virginia, or even, let's say, Arizona or Kansas or something like that. So it's understandable that you could have open classes, or be present in class in the old way. In some states, in some cities, in some small communities, whatever. And in others, and I'll just use Maryland as an example, okay? I have two members of my family who are teachers in the elementary, middle, and high schools. And so right now, the whole state of Maryland is virtual, just as FCC is. So it might be very appropriate to have a virtual school in a city such as Frederick or in Baltimore City or something like that. But it's not necessarily that would need to be the same in, let's say, rural Western Maryland. Although they probably are under the same mandate from the government, I'm not sure that that's really necessary. But it'd be very difficult for Governor Hogan to say, well, this mandate of virtual classes needs to be implemented in Baltimore and Washington, Baltimore and Frederick, et cetera, but it doesn't need to be in Western Maryland, in one of those schools up there.
Okay. So are we anticipating there to be a spike in cases this coming fall?
That's a hard question to answer, Katie. On one hand, the colder weather always brings people indoors where they come into close contact with others. And that close contact facilitates infection or transmission of the virus. And so, but the presence of a vaccine or the development of a vaccine as early as maybe December or early winter, first part of the year, might play a major role as to whether or not there are spikes in the virus. On the other hand, the fact that people now are practicing more safe distancing and using face masks, etc., there's most certainly going to be a decline in the number of people who get, let's say, the common cold or the flu or something like that. And perhaps the same thing with COVID-19. So maybe this social distancing and safe practices might offset a major spike, such as might have occurred this last winter when people were naive about how to react to this virus.
So where are we with the vaccine?
Well, I also looked into that, and of course, that kind of thing is always on news when you turn on one of the stations that are newsworthy. So I understand from several sources that our country and several other countries are making significant progress, and that there will be more than one safe and effective vaccine by early 2021. Before I answer that a little bit more, I want to distinguish for your class the two terms that are always used when it comes to a vaccine or any other kind of medicine that's administered to humans. First of all, it has to be safe, which means it will not harm you. And secondly, effective, which means it does what it's intended to do. In other words, a vaccine is supposed to protect you from disease, and that's its efficacy. So it has to be safe and it has to be effective. So several credible pharmaceutical companies are now reporting that they do have a vaccine that will very soon be available, which are safe and effective. And based on my experience and my understanding of having worked in the vaccine field, I have a high degree of trust, not only in the United States, because I know intimately what's required in the United States for our Food and Drug Administration to grant a license to a vaccine manufacturer. So I wanted to be clear to your class that somebody might say, well, will we get the same degree of safety if the vaccine is produced by another country or another pharmaceutical company that resides in another country? Yes, you will, because the same standards are applied by the Food and Drug Administration, no matter whether the vaccine is made in the United States or in Europe or whatever. So we can trust that. However, I do think that probably the United States, and particularly President Trump, is committed to purchasing the new vaccine preferentially from a U.S. company.
Okay. So I'm going to move. So how do antibodies from people who have already had the virus, how does that play into the creation of a vaccine?
Well, first of all, I want to distinguish between using antibodies to protect an individual versus using a vaccine. So the use of what we call convalescent serum, which would be antibodies from an individual that has already recovered from a virus infection, such as COVID-19, is called passive protection. In other words, an individual who has been diagnosed as having COVID-19 would be eligible to receive serum from a person who has already survived an infection with COVID-19. So that's passive protection. And that's been a very highly and effective approach over decades for protecting individuals from a variety of infectious diseases. And I could name a couple, but that's not important at this point. And so that whole approach, that passive protection approach, is different from the vaccine, which is referred to as active immunity, because the vaccine is what induces an antibody response in the person that gets vaccinated. And so it's that person's immune system that now becomes programmed to be resistant to the virus, not the benefit of receiving serum from another person who had the virus.
Okay, I want to make sure that I'm leaving plenty of time for our students to ask questions. So I just have one more, and that is, with your experience of historical knowledge, will our society return back to normal? Or do you predict that things are going to function differently?
I guess I question the word normal, and I'll answer it this way. Right now, I believe that the future will be different, no matter what happens. In general, our population and the average citizen is going to respond much more quickly the next time that there is anything like COVID-19, and Lord willing that there will be plenty of time in the future, and it's predictable that there will be other viruses, even mutants that arise from COVID-19. So I believe that our population, not just our country, but maybe the world at large, is going to be less naive, and they're going to be more prudent when they hear about an outbreak, and they won't be one of the disastrous types of stories that we've heard that occurred in our country early on, where people said, oh, it's just going to be another flu virus, and it's not going to be not very serious. So we've learned from that. But our industrial base and our technology that has developed rapidly in the matter of, let's say, 8 or 9 months as a result of COVID-19 will better prepare us to cope for the future. Because, you know, the president is saying all the time about how many thousands of respirators we now have in our inventory, and there's been all of these new tests developed and new vaccines and new other drugs that have been tested. So we have a much better arsenal to protect against the next time, and I don't think that, at least the United States, won't be naive again.
Okay, so I'm going to pause there with our questions, and now I'd like to open up the floor to students here. And so if you would like to turn on your cameras, you do so. And if you have your questions ready, I'd love for you to take this time to ask Dr. Fine questions about coronavirus. All right.
You might have already answered it. I might not have heard. Do you think the United States was well equipped to fight the virus? And if so, what could they have done differently to better fight it?
Okay, Daniel. I think I'm going to repeat your question. And that is that we are much better equipped now, but we could have done better in the past. Is that basically what you're asking?
Yeah, well, do you think at the start of it all, were we well equipped to begin with, or could we have done things differently at the start to have prepared us for this type of pandemic?
I think I can answer that in a frank manner. No, we were not well prepared, because I think that the United States has never experienced anything like this since maybe the 1910 to 1920, when we had a massive flu outbreak and it killed thousands of people. So I think the development of the flu vaccine sort of made us biased that all we needed to do was have a new flu vaccine every year, and you know, there would be some people would get sick and very few would die, etc. So we had that naive approach that we were well prepared, and we thought if there was anything like, you know, another infection, it was going to be basically another type of flu virus. No one ever suspected that there would be a virus that was much more virulent, meaning it would have more potential to kill people and overwhelm them. And so we did not have respirators. We did not have the vaccine production capabilities. We were ill prepared.
Thanks, Daniel. Okay, who has another question? Yes, Alicia.
Does a person's blood type affect how sick they can become?
Alicia, would you please repeat that? I didn't catch the first part of it.
Does a person's blood type affect how sick they can get?
Does a person's...
Like what type of blood they have?
I'm sorry. First of all, I have poor hearing, but also I don't have a good connection with you. Katie, did you get that?
Mm-hmm. Yep. Does a person's blood type impact how sick they're going to become?
Okay. Alicia, I probably can't give you an accurate answer on that, but I have not heard any information thus far that blood type has any influence on whether or not you're susceptible or how severe the infection would be.
Okay. And also, if you've like already recovered from COVID, what's the possibility for like getting reinfected, if that's even possible?
I would say, from my experience and understanding of viruses, that very unlikely that you would be reinfected because your body will carry those antibodies or that immunity for years, actually for the rest of your life. So as long as you didn't come into contact with another virus it was not identical to COVID-19, you're fine. But in terms of getting reinfected by COVID-19, I'd say, absolutely zero chance.
Okay, thank you.
You're welcome.
Dwayne, I saw that you had a question.
Hey, by the end of 2020, you think we're gonna have a vaccine or not?
Yes. Dwayne, probably by the time Christmas comes, so to speak, December, there will be probably, and I'm just speculating, a half dozen different vaccines that'll be contending. When I say contending, I mean competing for approval by the Food and Drug Administration. And which ones get approved is going to depend upon their safety and efficacy data, as I explained a little bit earlier. So it won't be just one vaccine. And I believe that the United States will begin to buy as many doses as they can from as many companies as they can that have proven that their vaccine is going to be safe and effective for, at least for the US population.
I got another question to piggyback off of that one. You think it's gonna be effective or not? The
I
vaccine.
think it will be effective.
Well, it's hard to say, but I will tell you that more than likely it will not be licensed unless it has been proven effective. Now, you might ask the question, well, how does that work? How do they prove that it is effective? Well, at the same time that the vaccine manufacturer has been manufacturing thousands of doses, and in this situation, this is very unique because rather than waiting until the vaccine is approved, these companies are risking their own money to manufacture millions of doses in hopes that once their vaccine is licensed, then the US government will buy it from them. So in order for the US government to buy it from them, they have to demonstrate in individuals that are willing to be vaccinated by with the vaccine that are at high risk. And if those people that are at high risk do not contract the virus as compared to a control group who are vaccinated but not with this vaccine and do come down with the virus or virus infection, that's the way they show efficacy. So that may be a little complicated the way I explained it, but if you understand in the scientific method, you always need a control for an experiment. So in the case of developing vaccines, you would ask for volunteers. Let's just say in a small study, you had 100 volunteers and 50 of them, none of them know that they are going to get the vaccine. And none of them know which are going to get the control. So 50 get control, 50 get the vaccine. Then those individuals are exposed, now not deliberately to the virus, but they may live in an area where there's a high concentration of the virus. Well, if more of them survive or don't get sick that have been immunized with the vaccine, then it's effective. Now, you'll say, well, that sounds ridiculous, but I'm talking about efficacy studies where there are maybe 100,000 volunteers. And where do you get those? First of all, there's people around this country already who have volunteered. And there are people in third world countries around the world who also are willing to take the vaccine. So that's the way efficacy study is done. And those studies are currently ongoing.
Wow.
Thank you, Dwayne. DJ, did you have a question?
Yeah, I did. In the state of Maryland, are there free tests for every Maryland citizen now?
Are the free tests?
Yeah.
Yes, the tests are, there's no cost to it. I've actually been tested twice, not because I've been exposed to the virus, but that I had two medical procedures. One was simply a sleep study because I have a little bit of sleep apnea. And so that's required for many medical procedures, is that you have a test for COVID-19. So there's no expense for those. Now, it's futile, though, for people just to say, well, I'm going to get tested because maybe I had it. So you have to have a good reason for being tested. Now, I don't mean good reason is like you have to have a written testimony or something. But basically, if you feel like you've been around somebody who has the virus or who has been ill, family member, something like that, you can simply just get permission from your doctor, and they'll send you for a COVID test, and that shouldn't cost you anything. Other questions?
This kind of goes back to my original question.
Okay.
Do you think we are better equipped to handle a different pandemic like this in the future, or do you think all of this craziness can happen again?
I think, let me answer your question, Daniel, in sort of reverse order. I think that we are going to have in the future other sort of deadly infectious diseases, okay? I think that there will be other forms of COVID-19, other mutants, but we are much better prepared. And I think that the response will be quicker. I think we have the industrial base developed. We have the technology for detection and testing. So it should never be anything as bad as this, or even partially as bad. And I think the general public, the individuals who are seriously concerned, are going to practice good hygiene no matter what happens. And I would predict that even when, as far as the annual flu, we're going to see a decline in that just because people are going to be more cautious in the future. So I hope that answers your question, Daniel.
Yeah.
You're on mute.
I am on mute.
Mhm.
Who else has a question? If you are more comfortable sending it to me and in the chat and I can ask it for you, I'm happy to do that. Anybody?
I have a question.
Great, Avery.
In the lab, we learned about herd immunity, and I just was wondering do you think that we will ever reach herd immunity for the coronavirus?
Avery, that's a very good question. In fact, that was one of the things that Katie and I had talked about prior to this session. Let me just define herd immunity for the rest of the class. Herd immunity basically means that if you allow a disease to spread among individuals, now that could be a herd of cattle or could be a herd of sheep, or it could be human. So the term herd immunity means that you deliberately allow a disease to spread from one person to another, and in time, the whole population then is immune to that. And I'll give you a very good example of herd immunity. Polio virus, when I was growing up, was a deadly disease. Polio was affecting people around the world, and it was paralyzing many of them because it affected their brains and would paralyze them. In order to create herd immunity, they developed the polio vaccine, and they administered the polio vaccine. It was a mandate because of the fact that it was paralyzing and killing a lot of children. It was primarily affecting children because they were very susceptible to polio. So they created herd immunity by basically immunizing the whole herd, all flocking. and they basically eradicated polio from the face of the earth. So there are no cases of polio anywhere anymore. Now, you might find an exception to that, but in fact, most all of the human population has been disease-free from polio. So when you ask the question about herd immunity here, that if you were to allow COVID-19 to run rampant, so to speak, and just everybody gets infected, well, that certainly would eliminate any further infections with COVID-19. However, you're going to have a high number of individuals that are going to be very sick, and many which would die. So to allow the virus to just run rampant throughout the world would create herd immunity, but there would be hundreds of thousands, if not millions of people would die. So the better thing to do is to try to identify those areas where there is high risk, and those portions of the population that are of high risk, like the elderly and immunocompromised, and give them a vaccine so that you can reduce the possibility that there would be spread of the virus. So that's the whole concept of herd immunity as far as COVID-19. I hope that answers your question.
Yeah, I did.
Okay.
Thank you, Avery.
Hey, I got a question.
Okay.
Dwayne?
What percentage of diseases you think is man-made? I mean, viruses you think is man-made or not?
Okay. Dwayne, I'm going to repeat what I think you're asking. You're asking whether part of the virus is man-made. Is that what you're saying, or?
I'm saying viruses in general, what percent you think is man-made and what percent you think is just nature?
I'm going to ask Katie just to, because I'm not getting a very good pickup from Dwayne's microphone. But.
So I think what he's asking is how many of the viruses that we see are created in the laboratory, and how many do we find in nature? Is that correct, Dwayne? Is that correctly? Okay.
Okay. Dwayne, I've had this question asked to me many times, and so I need to sort of break down the question, your question, or the similar question that's been asked to me. It's very important that we understand that all of these viruses, no matter what virus you're working with, whether it's COVID or whether you're working with influenza or working with polio or whatever, they all originated in nature sometime because they have been on our planet, are present on our planet for millions of years. And that's well documented through molecular studies. Now, researchers will often manipulate a virus in order to make it grow better. I did that for years when I was working with cancer viruses. We wanted to be able to study that virus, and so we would grow it in cell culture, which means outside of the body. We'd grow it in basically a test tube type of situation. And then we could learn more about it. So viruses like COVID-19 have been manipulated in the laboratory in order to learn more about them. And, you know, there was a lot of finger pointing when it came to the Chinese laboratory where this virus came from. And it's no longer debatable that it did come from that laboratory. But there's very little proof that it was a deliberate creation in that laboratory. I don't think that anybody tried to create a deadly virus. I think they were trying to study the virus, and that virus had already been capable because, as I mentioned before, that human cells have the receptors on it just like the bat cell. And so this particular virus isolate that was being grown in China was able to get out of the laboratory, so to speak. It either infected accidentally a lab worker who might have gone into the community and spread the virus or something like that. But, you know, none of these viruses are a creation in the laboratory. They are manipulation in the laboratory.
So would you say all of them are manipulated with, or what you think?
Again, the volume is not loud enough for me to hear you.
You think all of them
Are
or no?
all of the viruses, are all viruses able to be manipulated?
No, not able. I'm saying like you think they were manipulated.
So do we think that the coronavirus was manipulated? Is that what you mean?
Viruses in general. I'm talking in general.
If you're asking me to give you my professional, unbiased opinion,
Yeah.
and I'll answer it this way: all viruses can be manipulated. From the time that I worked with viruses in graduate school and then all through my research career, we were doing various things with viruses, not deliberately to try to create a monster virus or anything like that. So yes, we have the tools to be able to change viruses. We can put new pieces of nucleic acid in them. We can take pieces out of them. We can make them less virulent, meaning less infectious, by treating them a certain way. So we can manipulate them. We have the tools to do that.
That wasn't my question, but it's all good, Doc.
Okay, guys, so we are 5 minutes past 10:30, so I appreciate you staying with me. And Dr. Fine, will you stay on for a little bit longer in case folks want to stay and ask any further questions?
Well, thank you, everybody. I enjoyed being present virtually with you today.
Thank
So
you.
thank you all. If you would like to ask any questions, go ahead and stick around. But otherwise, I will see you all next week.
Thank you.
Thank you.
Thank you.
Now everybody want to pop out.
Katie, it looks like there's just one person still on.
I know. DJ, do you have any questions? Nope. I guess not. All right, I'm going to stop our recording.